Let me just, is that on? Great. Well, I was asked to just make a few comments in reaction to the direction of the group. I think my first thought is just affirmation and applause of what the group is doing. It doesn't surprise me when I see who's involved with this effort, but I think the three key deliverables that you've outlined will really help move the field forward. And I'll just make a comment or two on each. I really applaud the approach of creating a compendium of instruments rather than trying to pick an instrument. Having seen literally decades of effort wasted on that rabbit hole of picking a single instrument, what we really should do is centers using validated instruments with benchmarks that predict outcomes should be applauded and told keep at the vanguard and keep pushing the field, not trying to waste our energy convincing them to change metrics for which they have decades of longitudinal trends. I think that in that space, we really want to say, what are good instruments that can be used? I think on the instrument front, too, there's been a lot of discussion around, do we need a publicly reported, transparent metric of the well-being of the healthcare providers at organizations? I think that's dangerous footing, and we have to be very careful there as well if we want honesty in reporting. It's one thing to have patients who are independent sort of reporting about their experience at a medical center. Those whose employment depends on that medical center and whether patients would be turned away if something was publicly reported in a way that's not advantageous, we might sort of have unintended consequences. I think when we think about our safety work, the things that are objective, we externally report. But when we ask folks about the safety of their unit, we want honesty in reporting so that we as organizations can really understand where the troubled units are and go and do the heavy work. And I think if those type of measures were sort of publicly reported, our faculty, our staff, our employees may not give us as honest an opinion. I think on the gaps analysis, really a remarkable paper that the group put out a week ago that I think does really nicely articulate where we need to go. And I do think that funding is the biggest barrier to making progress. I think there's a good understanding of most of the problem, and we're at that place where we need to pivot toward interventions. And as we do that, we need to draw people into the field who are not currently in the field. There are not a lot of systems engineers here. There are not a lot of design thinkers here. There's not a lot of organizational science experts from the business community here. We need those people to help us with this problem. There's not a funding reason for them to come into this space and join us in this journey. And I think we need to find ways to fund the right experts coming in, the right types of studies and interventions to work on things. I think my last comment on the gaps piece is that we need to be careful not to try to oversimplify a very, very complicated problem. And there are individual factors that are a big component here, but there are many complex work unit, organization, societal level factors. We know that while some variables like resilience may benefit all healthcare workers, many of the others are unique. I thought Dr. Moss said it well when some of the triggers are different. You know, an ICU nurse working nights and weekends probably needs different interventions and has different challenges than a family practice nurse working in the outpatient setting in more of an 8 to 5 type of a schedule. So where we identify things that will benefit all, we should obviously focus a lot of energy on those things because we'll have a compounding effect. But we want to also recognize the unique challenges of the pharmacist, of the physical therapist, the social worker, the nurse, the surgeon, the family doctor, and not just lump all those things together, but say if we really want to move the needle for family doctors, we might have to do something different than what we do for radiologists, and make sure we're doing all the things that will have a high impact. So I think those are just general thoughts. Thank you.
Thanks. All right.